Good evening. I am Dr. Parijat Deb Choudhury, consultant interventional cardiologist from Medithics Clinic, Mukundapur, Kolkata. Today I want to share with my friends and family few facts about heart disease or cardiac ailments. Nowadays heart disease is increasing in number and we are getting many patients who are suffering from acute heart attack, who are suffering from cardiomyopathies, heart failures and other problems. Post COVID, there is an increase in heart disease problems, and many factors are related to that. Now, many of my patients or their relative, they always ask me a question: if I have a heart problem, how can I understand that I have a problem? So I want to discuss on that. There are few problems which are very obvious that it is from heart disease. If a patient is having chest pain, which is mainly central or retrosternal, and it is burning or squeezing or pressing in type, then it is most probably due to heart problem. Now, heart disease chest pain are normally associated with excessive sweating, associated with sometimes shortness of breath, palpitation, and maybe it can radiate to left hand and left fingers and sometimes in the upper back. And one very typical feature of angina or a heart pain is that it might radiate to the jaw also, but mostly it doesn't radiate below abdomen. So this is the most common problem associated with heart disease, that is chest pain. The second most important symptom is shortness of breath or dyspnea. The heart disease develops slowly, and in some cases patient actually get dyspneic while they climb stairs, or if they do some excessive exercise or do physical exertion. Sometimes even at rest they might get shortness of breath. So shortness of breath is another very important symptom of heart disease. Third important symptom is palpitation. Palpitation is mostly regular, sometimes it might be irregular also, and that is due to atrial fibrillation. So the most important symptoms associated with heart disease are chest pain, palpitation and shortness of breath. But there may be other symptoms also, and those are nausea and vomiting. Sometimes there might be fatigue and a feeling of uneasiness, excessive sweating, and maybe fainting or dizziness. So all these problems, if happen suddenly in someone and they are not feeling good, they are feeling some type of congestion in chest, my advice is, rather than sitting at home, they should immediately go to a doctor, do at least one ECG and find out if any cardiac problem is there, because any problem, if it is diagnosed early, then can be treated fully. And cardiac problem also similarly, if we are able to diagnose it very early, we can almost cure it. So we should not delay the symptoms or doctor consultation, and do the needful as soon as possible. Thank you.